Hi, my name is Darshini Ayton, and today I'm going to talk to you about the top 10 questions I get asked about qualitative and mixed methods research. And it's really to help people to start thinking about the why and the how of qualitative research, particularly when this is potentially your first project doing a qualitative research project, to understand what you can do and best practice. So question one, why qualitative research? Well, we adopt a qualitative research approach when our projects seek to understand complex situations or circumstances or poorly understood phenomena. And you'll see the word phenomena quite a bit in qualitative research writing. Basically what phenomena means is anything or everything that you're considering. And so for example, the phenomena of getting a joint replacement surgery done. And so when we want to understand the complexity of that, or if that hasn't necessarily been elicited from a patient perspective, then a qualitative research approach is suitable. When you want to ask participants some broad questions, and often what I find is someone will send me a survey that they've started to develop up, and all of the survey questions are open-ended. And I often then will go back to them and say, look, it sounds like you're asking very broad questions, open-ended questions. You're asking your participants to actually write a response as opposed to tick a box. This might indicate that you're actually doing more of a qualitative research project because the information you want to get is a little bit more about experiences and attitudes and beliefs. You want to explore the impact of social, cultural, political factors on health and disease. Qualitative research is a go-to. And you want to examine the interactions and behaviours of individuals and groups. And so having a little bit of a look at that complexity, how and why is a qualitative research approach. So if we were to compare the pair in terms of quantitative and qualitative research, quantitative research is hypothesis testing. So often you have a hypothesis you're testing, and it is what we call deductive in that approach. It is objective. You're often looking for associations, causations, relationships, effect. You'll see that in the research aim, research questions, these are types of words. You're answering what type questions. So what is the incidence? What is the prevalence? What is the impact? Or do questions around effectiveness. Does this intervention, does this activity have an effect on X, Y, and Z? And it's very much the science of numbers. It's objective, it's quantifying. Qualitative research is hypothesis generating. And so it is not about testing a hypothesis, but it is about generating ideas and concepts around a hypothesis. And so it's inductive. It is subjective, and that is just part of the paradigm of qualitative research. It seeks to describe, understand, explore, discover, generate, examine. So these are the types of words we might see in an aim. It answers why, how, and what types of experiences, research questions. And it is the science of words and pictures. What is my qualitative study design? So this is the other thing that when I'm reviewing journal articles or when I'm reviewing a student thesis and they say, I did a qualitative study, that would be like me saying, I did a quantitative study. There are so many different types of qualitative studies, and this depends on what is your research aim and question, what forms of data collection did you undertake, what kind of analysis did you do. So you need to specify the study's design. Don't just say it was a qualitative study. So here are some example ones. So phenomenology is very much grounded in the individual experience. Case studies is looking at a phenomena within the context of a case, and there can be multiple cases, there could be single cases. Action research is when you have some type of change or intervention that you develop together with the community. Ethnography will often incorporate participant observation that's interested in group behaviour, culture, hierarchy. A descriptive study is sometimes what we say our qualitative project is if we don't know what it is, but it's very much around who, what, where, a little bit more of a journalistic approach. And then grounded theory is when you are developing up a theory. So it's really important to understand what is your study design. There are theoretical underpinnings for this, and not just to say I'm doing a qualitative study, because they have different characteristics which are important to be able to elicit in your projects. Mixed methods are increasingly becoming popular, particularly in health services research. So it's very important that we understand what is mixed methods research, and also, are we actually mixing our methods? And so I always come back to this typology, if you like, from Creswell and Plano-Clark, which goes through the different forms of mixed methods research. So triangulation, where you have quantitative and qualitative data happening concurrently, and you merge your data sets at the point of analysis. You can have embedded, so this can be particularly for a randomized controlled trial where you have a large quantitative component and you might have a qualitative program evaluation embedded within it. You can do an exploratory mixed method, so this is where your qualitative project might happen first, and then based on the findings of your qual, you design a survey, and then you do a survey study afterwards. Or you could do an explanatory mixed method study where you have a quantitative data set, for example, from a registry, and based on the analysis of that, you might then follow up with some focus groups or qualitative interviews to help explain the patterns you might have seen. So these are really helpful ways to think about mixed methods, and I would encourage people who are doing mixed methods to really use this terminology to help readers and assessors to understand what your approach was and why. Are focus groups and interviews interchangeable? No, they serve different purposes for data collection. So interviews, you can have multiple forms of interviews. They can be semi-structured, they can be in-depth. You can't have in-depth semi-structured interviews. They're two different interview designs. You can have key stakeholder, you can have narrative interviews, and the focus of an interview is on the individual and the story that they're telling you, or the expertise that they're telling you. Focus groups are more about group dynamics. It's not a group interview. And so often your interview guide is not going to be suitable for a focus group guide. You want, in a focus group, your participants to interact with each other. And not all questions that you might want to ask in a focus group are suitable. So if you're asking sensitive questions or really personal information, if your first question is something like, tell me your story, or what happened when X, Y, and Z, and you're wanting to go through individuals, that's not suitable for a focus group. So really think through, what is the purpose of my data collection, and which form of data collection is going to be able to achieve that purpose? How many interviews are enough? Now, we get asked this in funding applications a lot of the time, ethics applications, and it's really, really tricky. There are massive debates around the concept of data saturation. I quite like the concept of data saturation, I'm not going to lie, but I do think it is something that has been abused, and it's almost been a little bit of, I'm just going to say I'm going to do this amount because that's how much I can budget for, or my resources, and that's not what data saturation is about. So what we're talking about with data saturation is when there's nothing new is apparent, or information redundancy from your interviews. Because you could do 90 interviews, but you might have stopped hearing new things, particularly as they relate to your research questions at interview 15 or interview 20. And so you need to then have conversations as to whether or not then going to 90 interviews was a good use of resources and time. It's about the depth of your data, not about the breadth. And so that's the other thing that we get pushback in terms of sample size for qualitative research, because they will often say it's small. Well, we're not seeking to be generalizable, okay? And I think that's one of the first things you need to be talking about. This is meant to be representative of people who have these particular characteristics and their stories and experiences, and it's about depth, not breadth. So your data saturation concept will depend on your research question and your population. It's not a one size fits all. If you have a very heterogeneous population or sample, then I would imagine you'd have more interviews or more data encounters to be able to explore this. It depends on your study design. So for grounded theory, you generally need to have quite a large number of people because you are trying to develop up a theory. So you need to get enough information to be able to do that. And we call that theoretical saturation. There have been some recent papers, and Guest et al. He wrote a paper in 2006, which looked at how many interviews is enough. And that came out at about 12, his analysis of different qualitative studies. There's been a recent paper he's released which has looked at ways that you can kind of analyze how many interviews are enough, and through doing that process they came to about 11 to 14 interviews. But again, it's a very inductive approach, and it really needs to be about that detailed analysis, and you need to provide a rationale and evidence and a justification. So if you want the flip side of people who don't like the concept of data saturation, particularly for reflexive thematic analysis, then you've got Brown and Clark who can very much write to that perspective. But for more applied health services, public health research, you will see the concept of data saturation a little bit more, and just for your general thematic analysis, that is a very accepted terminology to be using. Should I record my interviews and focus groups? Where possible, I would say yes. Record, transcribe, and code the data. The reason I said this, I've done interviews with and without recording. And already as an interviewer, as a researcher, the data is filtering through me. I'm the data collection instrument, I'm the data analysis instrument. And I feel like recording is a really rigorous approach, because sometimes I can walk away from an interview with impressions that may not necessarily always be accurate once I've gone back and re-listened to the interview or looked at the transcript, and I might have missed things. I would say for a PhD student, and my supervisors did this to me, it is really helpful to actually do your own transcription if you have time and capacity, because you learn when you do your data collection well, when you've asked the right follow-up questions, where you might need to improve, where your question's making sense, but you also become very close to your data because you're basically living and breathing it while you're transcribing. You can use a professional transcriber, but also you can use those audio to text kind of programs. They're not always that accurate, and so you just might want to weigh up what the pros and cons are of that. But it is important to put it into your ethics applications if you are recording and if you're getting it transcribed. Question 4, do I have to use a data management software? There was this article that was published in 2007, which was basically a decision tree to determine if you needed to use in vivo to analyze qualitative data sets. And I think it's a really good point, because you don't have to. For years, qualitative researchers did data analysis by hand. But it does depend on, how many coders you're going to have, the complexity of it, how many interviews you're doing. And so it's worth having a look at this and really trying to understand, is it something that I do need to be using? And I'm not saying NVivo is the only software program you can use. I think the other thing to keep in mind is programs like NVivo, they're data management programs. They're not data analysis programs. You still have to do the manual aspect of that coding process. And so I guess it's not like you're pressing a button and it all happens. Is double coding required? Again, there's debate about this, but I'm not sure where you guys are publishing. But if you are publishing in public health or health services journals, you will find that they'll ask you to fill out the COREC or the standard reporting guidelines for qualitative research, the SRQR or something. And so they will generally say, how many data coders did you have? I actually think it's a useful process because, again, as I said before, you are, as the researcher, the data collection instrument and as and the data analysis kind of tool. And so a way to improve or increase the rigor of your research is to actually have other people with different lenses and experiences involved in data analysis. And increasingly also having consumers or patients involved in that process, because you bring different interpretations and lenses, and that can only enhance the quality of your data analysis. And so I would say it is something that is good practice to do. Do you have to double code your whole sample? Maybe not. You might double code 10% and see, were there new things or ideas that were coming up, and then you might do a little bit more if it was something that was of benefit. But again, have a think about what your research questions are, where you're publishing, what the requirements might be around that. What is member checking? So this is the other thing that I find interesting, is that people will say, oh, I offered participants the opportunity to review their transcript, and so this was member checking, and it is enhanced the rigor of my study. When we say rigor, it's trustworthiness, right? Like, how can I believe or trust, because it is a subjective process, that your interpretation of the data is true or trustworthy? And so member checking isn't about checking the transcript, it's about checking your interpretation, your analysis. And so this can be done by presenting back to your participant groups. It can be done by presenting team meetings and conferences, by involving consumers or patients through the whole analysis process, sending chapters or papers to review for members of your participant group. All of this is really, really helpful to enhance the rigor. But please don't say, okay, I've given them the transcript, because that's just a documentation of what was said, not of an interpretation. And the number one question I get asked is, how do I write up my qualitative research? So some tips from experience: use reporting guidelines. That can really help. I know it depends on the journal, but it can really help set out what is needed in each section of your paper, and your methods and your results. You know, particularly concepts around research positionality. Who are you as a researcher? Some journals really would want to be able to see that. Detail your analysis properly. And I know word counts can be tight, but don't be too general and just said, oh, we followed these different steps. And I see it quite often. They'll say, oh, we've you know, gone through this step of coding and then theme development, and these are our themes. But, you know, link it back to your research questions, link it back to your analysis questions, talk about how codes were generated. Helpful to sometimes put that in supplementary materials as well. Find a journal that publishes qualitative research, and particularly then also has reviewers who are going to review it and not come back to you and say, this is too small. Make sure you provide evidence for your theme development via quotes, and so present quotes to support your themes. This is your data. You need to say this is where it came from. Make sure you present quotes from a variety of participants, and that's why you need to have a code or a pseudonym for your participants, so that as a reviewer I can look through and say, yes, they are presenting. If you've got 17 participants in your study, I can see that there's a variety of participants whose quotes have been presented, as opposed to it only coming from one or two. Compare and contrast results. That increases the robustness of your analysis. It's not as then just descriptive. And so put in an interpretation of why people may have been saying different things. Consider using a table to present your themes, your sub-themes, and illustrative quotes if your word limit is tight. Consider developing figures and mind maps to illustrate complexity and relationship. And just be aware that there are some journals that will allow you to combine your results and discussion in one section. They're more of the social science journals. Others will want these to be separated. And so very much understanding what the journal requirements are. And my tip to you would be, if you know where you want to publish, find an example paper and use that as a template in terms of how to present and your data and your analysis, because you're more likely to get it up that way. So I hope that was helpful. Thank you for the opportunity to present and to talk about a topic I'm incredibly passionate about, which is qualitative research. It is a very valuable research technique and tools to have in your researcher toolkit. But I think it's very important to understand that it comes from a different paradigm to quantitative research, and it's not fair to put the rules of quantitative research around qualitative research, because it has a very different form of characteristics and information that it will produce. So I hope this has encouraged some of you to do qualitative research well, and happy to take any questions. Thank you.